Today we're chatting about seasonal allergies with Dr. Lisa Kobrynski, who is a pediatric allergist here in Atlanta with Emory Healthcare. A number of our members have sent in questions about this topic to ask Dr. Kobrynski. First up is Julie Sandman from Atlanta, Georgia.
So when my son gets sick, how can I tell if he has the cold, the flu, or allergies?
So one of the problems with allergies is the common names, things like hay fever. And that implies that there's a fever associated with allergies, which is not generally the case. So in contrast to a cold or influenza, allergies are not associated with fever. Usually the symptoms are more itchiness of the nose and eyes, a clear runny nose, sometimes wheezing or cough.
My son was recently put on a medication for his allergies and his asthma, and I've noticed some mood changes, and I wonder if this is common, and should I be concerned?
It's important for one to distinguish between known side effects from a medication and those side effects that are unusual or severe. Most first-generation antihistamines like diphenhydramine or Benadryl tend to cause drowsiness and sleepiness in children and adults, and so those types of side effects would not be unexpected. They can also cause paradoxical excitation in some children, and again, that's not an unexpected side effect. If one is bothered by those side effects, then the medication can be discontinued and the side effects should stop. In contrast, there have been reports with Montelukast or Singulair of mood disruption and increased emotional lability in some children on Singulair. This is based on case reports to the FDA, and the FDA has given out a black box warning detailing this. The exact frequency of this side effect is not clear. However, in clinical practice, it does not appear to occur very often. Parents should look for any unusual mood swings or mood changes in their children after starting these medications. If they have ongoing concerns as to these mood changes, they should discuss this with their physician.
Hi, Dr. Kobrynski. I have allergies, and I've heard about a new allergy therapy known as sublingual immunotherapy that allergists are actually starting to offer to their patients. I'm a little concerned, though, because it hasn't been FDA approved. Could you please tell me about this new therapy, and should I be concerned?
So traditional immunotherapy for allergies involved injection of small amounts of allergen with increasing doses over many weeks, given in an injection under the skin. This was typically carried on for 3 to 5 years and usually resulted in very good response with decrease in symptoms and a decrease in need for medication. Over the past 6 or 7 years, there have been numerous clinical trials underway, mostly in Europe, testing the efficacy of sublingual immunotherapy, which is the administration of drops or tablets under the tongue using small doses of allergens. This has been successful using sublingual immunotherapy preparations for single allergens like ragweed or dust mites in a fairly large population of patients. However, the dosing has not been standardized. Currently in the United States, there are several clinical trials underway looking at the efficacy of sublingual immunotherapy, and it does appear to be promising. However, at this point in time, this is not approved by the FDA, so that there is no standardization of extracts and there are no guidelines regarding the dosing and frequency and how long this administration should continue. There are side effects with immunotherapy, both with subcutaneous and with sublingual immunotherapy. With sublingual immunotherapy, frequently patients complain of itching of the mouth and itching of the throat, and there have been some reports of generalized allergic reactions, including anaphylaxis with sublingual immunotherapy. So at this point in time, we can't make a general recommendation for sublingual immunotherapy due to the fact that we don't have an FDA-approved extract, and we still don't have good practice guidelines for the administration.
My husband has had allergies for years, and somebody told him that local honey would help his symptoms in the spring and in the fall with his hay fever. I'm wondering if that is a viable medical treatment or if somebody's just messing with his head.
Bee pollen does not actually consist of any antigens from bees themselves. It actually consists of pollens from the flowers that the bees land on when they are attempting to extract the nectar. And so bee pollen has been used to treat allergies much in the same way that herbal remedies or homeopathic remedies have been used to treat allergies. As such, there's really no clinical evidence that this therapy has any effect on allergic disease. Honey, on the other hand, there is no clear rationale or mechanism for the effect of this on allergies, and we don't recommend routine administration of honey, especially to infants, for the treatment of allergy.
Dr. Kobrynski, I heard that there's a link between allergies and asthma. If I control my allergies, will that help control my asthma?
The allergic triad consists of 3 diseases: asthma, allergic rhinitis, and atopic dermatitis. It's felt that there is a genetic predisposition to these diseases, and numerous genetic markers have been identified. It's clear that in families where a parent or both parents have allergic disease, there is an increased risk of developing some form of allergic disease in the children. It's been noted in many studies that children who have allergies to environmental allergens like dust mites have a higher likelihood of developing asthma later on, or if they have wheezed as infants, they have a higher likelihood of having persistent wheezing throughout childhood. So there is a definite link between allergic disease and asthma. In children, about 80% of children with asthma do have some sort of allergies, so the link is very strong. There have been some trials done in Europe looking at administering immunotherapy to single allergens such as dust mites or ragweed to children who have a family history of asthma. And in these children, this was shown to decrease the rate of development of asthma. So additional work is underway looking at the ability to treat or prevent asthma with the use of allergy immunotherapy.
Dr. Kobrynski, thank you for joining us today. This has been really helpful. If you'd like more information on this topic, please go to our website at www.sherwick.com.